Hi, everyone. This is Matthew.Knight, financial advisor with Cetera Investors in Charlotte, here with a special guest and friend of mine, Marty Haynes of HFC Benefits, located in Lancaster County. Marty is a resource on all things insurance, and he started his career in Cigna, 20 or 25 years ago. I believe, Marty, you can confirm that with a nod there, and has opened his own business and has been in practice for well over 2 decades. Residing with his family in Lancaster County, located in South Carolina. Marty, it's good to have you on. We're going to be talking about Medicare because that enrollment period is coming up mid-October, correct? October 15th?
October 15th. It's the wonderful time of the year that everybody gets bombarded with mailers and commercials.
You're right. Bombarded with commercials, maybe phone calls, mailers, pumpkin spice, pumpkin patch, activities, our entire, I say other than Christmas holidays, around that time. October is just a slammed month. My family and I will be somewhere every Saturday in October until the end. I know we're not quite in October yet, but you know how we think. We forward think, and I'm already in October in my mind.
There you go.
As we talk. So Marty, I hope I got the introduction right. I love your website, by the way. Try to get that. One of the most genuine website bios I've read and come across.
Okay. Well, thank you.
Yeah. I love the story about how when you finished up school, you didn't want to go do the so-called tour of duty in the textile world, because textiles were popular around this part of kind of where we are and where you are. And so you were going to join the Air Force. But then I read there was a wait period on that, right?
That is correct. I had to wait about 6 months. I worked with Springs for about 6 months and realized I didn't want to run an inspection winder for the rest of my life. Yeah. And, just to back up a little bit, people put a lot of pressure on high school kids to make some kind of decision. And when I was in 12th grade, I wasn't 100% sure what I wanted to do. Right. I knew I liked planes. I like the military, so I went that route first to get a good idea of who I was, what I wanted to do, and I wouldn't trade that experience for nothing.
No, well, I appreciate your service and to the country, and I found the touch of humor in there where you had to go work in that manufacturing world for a little while the wait list.
Yes,
the Air Force worked itself out. So,
correct.
So I love the bio, and then you go on and talk about your family and everything, and I love the authenticity of it. So Marty, back on Medicare. Okay, so I get these questions a lot in my world. We're dealing with retirement. That always involves Social Security and health care. I think maybe last time you and I did a call like this, I talked about health, wealth, relationships. The interconnectedness of those 3 pillars in your life. So just to kind of kick things off here with question number 1, let's say someone is approaching that Medicare age. They got their mailer. They got, they're around 65, or maybe they get them at 64. They start thinking about this. What is the sign-up process like? So,
well, the good thing with that is you've got, the way they have it set up, you have 3 months prior to your birth month, the month you turn 65. So you have 3 months prior, you have the month of, and then you have 3 months after that. We always encourage people to get in here beforehand. And you first have to, of course, you gotta go online and sign up that aspect of it for Medicare and all that good fun stuff. And then what we do, once you get your, they call it the red, white, and blue card. Once you get that with your Part A and Part B, that's where we come in and help with some of the confusion and the clarity of it, because like we said earlier, you wind up with all these mailers. You get all these celebrity commercials online telling you call 800 number, which I always discourage that, because people sign up for things because they don't know insurance, and there's a lot of confusion. They sign up for things that they shouldn't. And so whether you use use us, or whether somebody else, use someone local that you trust, because I'm going to tell you, because it can be really, really confusing, that whole process. So, and everybody's different. Everybody's needs are different. when it comes to Medicare and what you sign up for. So we'll hit some of those points today, but like I said, it's unique for everybody.
Okay. Okay. Now you mentioned signing up online. What is the website? Is it Medicare.gov or do they do it through?
It's through the Social Security.
Through Social Security. So
Yeah.
it's SSA.gov.
That is correct.
Is where you go from there. Okay, that's an important thing I think for folks to know, because way back when, my original thought was, getting into this business, like, okay, Medicare, well, Google it and it takes you to Medicare.gov, and then you figure out that that's more of an educational site.
Yeah. And a couple of things, what we have on our site, and I have to backtrack a minute just for clarity. The name of the business when we first started way back when was Haynes Full Circle Benefits. We started adding all sorts of products because we kept getting asked. It's still legally Haynes Full Circle Benefits, but we changed it to HFC Insurance. And if you go to our website, you type in hfcinsurance.com. We've got a signing up for Medicare cheat sheet available there as well. So we try to make it simple. It's just a one-pager. Hey, you go here. This is what you do. After you do this, you give us a call. So we make that process easy for everybody.
Good point. Simplicity is better.
Yes.
One-pagers are good, not
Yes.
40 and 50 and 60 pagers. In this world, a deluge of information that we all get hit with. So sounds like that's a pretty straightforward process, and you provide a way that folks can do that in a very simple way. Now, okay, so I've now signed up. Let's fast forward. I'm going to pretend I'm that age. Okay, now what should one do? What should I do if it were me? The criteria for deciding, because I'm going to get hit with traditional Medicare,
right?
Part A, Part B. And then drugs, D, it skips C, but there is a Part C, and then you learn that that's Medicare Advantage.
Yes.
Which is a different animal.
It
what kind of light can you throw on that for us, Mark?
Well, when someone comes in and we sit down, we kind of figure out, what they know about insurance, what their health situation is, because you have original Medicare, A and B. And you can either get a supplement which picks up the deductible and the co-insurance for original Medicare. You can get a supplement, and then you can get a Part D, which is the prescription piece, and we'll kind of touch a little bit of that. You can go down that route, or you've got a segment of population that they see the commercials, they get Medicare Advantage for free. And they call these numbers and they sign up. Well, the key thing about the Medicare Advantage is basically the government is allowing a private insurance company to manage your Medicare. So you choose a plan, and you have a couple of things you have to remember on those plans. You have to use their network. Their network can be smaller. It's regional. And a lot of times the prescription Part D is included in the Med Advantage. So you may see a free premium if that's available in your county, to have a free premium. But what a lot of people don't realize is it may have a $6,000 out of pocket. So yes, I got a free premium, but if I wind up in the hospital, I may have a $6,000 hospital bill. So those are things that we have to sit down with the client and go, okay, your health situation. Well, I'm healthy. Well, okay. Do you like freedom? Okay, if you like to be able to go across country, if you have cancer and want to go to a doctor in Ohio, then you need original Medicare with a supplement, and that allows you to go to any place that accepts Medicare. So you have that freedom. Or you say, look, Marty, I'm healthy. I prefer the no premium. I can, all my doctors are in the Medicare Advantage network. I want a Medicare Advantage plan. So like I said earlier, everybody's different. You just have to know what you're getting, understand the product. And that's why it's best, like I mentioned earlier, to sit down with somebody and kind of go through these things instead of picking up a phone, calling an 800 number, and you don't know who you're talking to, where they are. And if you have any questions, you call back, you're definitely not getting the same person twice. So it's a very important piece of your healthcare. So make sure you do it right on the front end.
Okay. Good to know. Now, so that kind of reminded me of, in the working world, you have your health insurance offered through the company, sponsored by the company, and you kind of have, sometimes you have a choice between you know, high deductible, low premium, or vice versa. Is it fair to kind of compare these Medicare options to that, where you trade one cost off for another, potentially?
Yeah,
Okay.
if you're getting a supplement, you have different plan. They're letters. You can have different plan options to choose. They're all standardized between all the carriers. That's by law.
Yep.
And then on the Med Advantage side, if you decide to go that route, there are different plans. You can have different carriers that say may have a $2,000 out-of-pocket max. Some may have a $6,000 out-of-pocket max. You just have to look at the plan and understand what risk you're assuming. I mean, that's what insurance is. You determine what kind of risk you want to accept. So that's why it's important to know what you're signing up for.
Okay, good deal. Now on one detail on that. So let's say I were to choose Advantage at retirement. Let's say I was attracted to the low premium, and let's say I found an out-of-pocket max I thought was tolerable, and these doctors are reasonable. And I'm healthy.
Mm-hmm.
Fast forward 12 months, 18 months, 24 months, something changed with my health. My doctor won't cover this. I got in before I didn't have to prove evidence of insurability, correct?
Correct.
What's the worst thing? Have you seen a sort of a horror story or a backfire on a Medicare Advantage where someone needed to change and could not because they were being denied when they tried to change?
And that's a good point. If you have a Med Advantage, now every year you can, let's say you're 2 years in, you don't like this carrier, their network, you can, at annual open enrollment period, you can change to another Med Advantage. Okay, straight in, no underwriting, go through it. Okay. You say all of a sudden, well, now I don't want the Med Advantage. I would prefer to go back to original Medicare and get me a supplement. Well, you're outside the guaranteed issue period. Now you've got to go through medical underwriting for that supplement to pick up the deductible, the co-insurance, all those fun things. So that's one aspect. When we talk to somebody, I'm saying, look, if you think you may want to go to a Med Advantage at some point, get a supplement first. If you can afford the supplement, do the original Medicare with the supplement. You can always down the road go to the Med Advantage. Okay. You can decide to switch over. You just can't always go back to the supplement, because if you pass the guaranteed issue period, you've got, if you've got some health issues, you may have a problem.
Okay. And, roundabout figures, is it fair to ask what's a general, like in the field question, a general premium on one of these supplement policies? Because it sounds like it's something one wants to strongly consider, just as, like you said, insurance is managing risk and
it is.
What are we up against? Now,
every year you're going to have some carriers are more competitive than the other. Let's just use the roundabout figure. A supplement's going to cost you $150 a month. Okay. And that's typically, say, somebody coming on Medicare at 65. Now, if you're 80 and you're reapplying for different, and you want to apply for another med sup and you're going through medical underwriting, it's not going to be $150. But when you initially come on, let's just say, again, it's going to vary every year. It's going to vary based off the county. It's going to vary based off the carrier. So that's why we have a wide range of options to look at and kind of see who in our area, because, we do it on, both Carolinas. So, we look at who's competitive in that zip code, and that's what you have to look at. So roughly, I'd say $150 plus you're paying your Part B premium, plus you'd have to pay your premium for your Part D for your prescription. So that total monthly, it is cheaper than if you were still on group. I can tell you that.
Okay. All right. Well, it's a fair comparison. And I know the Part B, correct me if I'm wrong, Part B currently is $164, $165 a month. I'm rounding up maybe by a dime and a nickel, maybe.
If I got it right, it's going up to for 2024 to $174.80. I believe is the new number. So yes, that's increasing.
Going up by $10. Okay. Yes. All right. And I believe Social Security is going to get an index bump as well, but that Part B premium is going up. So, and also tied to a tax bracket, and that's a different conversation for another time. So Part B, Part D, a supplement. Let's go into what now some of these parts of what they cover on traditional Medicare.
Yeah,
it's self-explanatory. Obviously, Part D is for drugs. Yes,
right.
no brainer there. C is the advantage that's bundled, and we've covered that.
Yeah.
Let's talk about what A and B specifically cover and for how long. Can you speak to that for us, Mark?
Yeah, we'll hit a few things. Part A, you know, people like to say Part A is free. It is if you look at it that way, but you actually you've paid for it as you worked. If you worked for at least 40 quarters,
yes,
you know, you've paid for it. If you have not, then you will have to pay a monthly premium for your Part A. Most people wind up there's no charge for Part A when you go on, and those things like inpatient hospital care, skilled nursing, hospice, those sorts of things go towards your big hospital type benefits. And then you have the Part B, you're going to be more services from your doctor, like some outpatient services, preventive screenings, durable medical equipment, and you'll have a deductible with Part B, which is roughly this year, you're looking at, I think it's $226 a year on Part B this year. So, you know, go back to when they like to increase your Social Security, but they also increase the other stuff. So
they're right together.
Yes. So that's kind of what happens there. So, and then your Part A, you've got this year you have a $1,600 deductible. And you know what? I don't know if that's confirmed for the 2024. It may go up slightly. They made a statement. It may stay close to what it is. They like to take their time in releasing some of those things. So, and that's why it's always good. And go back to finding you someone local you can sit down with every year, because these things change and we get educated. We educate the client on what's going on instead of, again, picking up a 800 number. I'm just not a big fan of that.
I hear you. Now that we've got that part distinguished, thank you for that. Now, this is one thing that always kind of comes to mind, and you'll meet people who are still working. They're still working, very active. They're still working full time and needed at their company or needed in their business past age 65, and maybe they have not gone ahead and signed up.
Right.
So let's talk about what that process might be. That involves some communication with HR, I believe, on that side, if you're going to work and not necessarily go ahead and sign up. Right. And then it's going to go, and then after that, you know, what the penalty looks like if someone just flat out doesn't do it, and how does one run into the penalty to begin with? Right.
All right, a couple of things there. And it goes back to everybody's situation is different. If somebody is going to work and continue to work, and it depends on how much of the premium, health insurance premium, and the benefits that they have at that company, to really if it's best to go straight on Medicare. And as long as they're working, they can go on once they come off the group coverage. But if the employer's paying a good or all of their health care premium, I mean, you know, it's a good idea to stay on that way as well, as long as you can. But if they're not, I mean, it's always good to look. If you're turning 65, what will that look like? Your employer can't make you come off of group, but for them to look at the dollars and kind of look at it, especially if you're gonna you qualify for you go on Medicare, you got A and B, you got Part D, and then you got you a supplement, and you look at the total premium, like, well, this is less than what I'm paying here at work. Plus, I have a lower deductible that's going to be picked up by my supplement. So depending on what I've got, I may have a hospital stay that really costs me very little money. But if I was on my group plan and I had a $5,000 deductible with an additional $2,000 out of pocket, $7,000, I mean, you look at your Medicare option, it is more cost effective for someone who's Medicare eligible to go on Medicare and come off the group plan. So it's really, that's why, when we do group plans as well, when we're speaking with our clients and our employers, and we see somebody that's 65 or turning 65, we have that conversation and say, okay, let's look what you have here versus over here. And yes, if you decide if you come off a group and you decide you didn't want Part D, you didn't sign up for those coverages, especially Part D, because people will say, I don't need prescriptions, I'm not on anything. Well, if you don't get it when it's available to you and you decide 2 years down the road to come on Part D, well, there's going to be a penalty you pay in addition to the premium that you're paying, because you didn't elect your Part D when you had the opportunity to do so. So, those that say, well, I'm not taking a medication, I'm healthy, then we look at, say, look, just take something, go with the lowest cost plan. Mm-hmm. So if you wind up with something, at least you've got coverage. And if you wind up down the road really needing your Part D, you don't have a penalty, because all of a sudden now, I want Part D and I'm going to pay the premium plus all the penalties forever. The penalties don't go away. Okay. So we always suggest at least, the lowest cost option.
Okay.
Those things. So it is a lot to think about, because, like I said, everybody's unique.
Absolutely.
To what works for them.
Now, on that Part B, Medicare Part B penalty, can you speak to how that's assessed if someone, so say none of the other criteria was a factor and they just didn't do it? Yeah. How is the Part B penalty? Is it a hike in the premium? Let's tell the viewers, are they paying more, or are they getting less, or is it a combination?
Well, here's the fun thing about that premium. It's a fun thing. We've had more people get penalized for Part D. We have never had a client get penalized for anything with B. Okay. But what happens is, that B premium is based off income.
Yes.
So if you've had somebody that's a millionaire, multi-millionaire, they're not going to pay the $174.80 premium. They're going to get adjusted $400, $500 a month for Part B. A lot of people don't know that. We've had some group clients, sell the business, or somebody could come into a lot of money. And when they look back at all your income and what you filed over the last 2 years with the IRS, they're going to base your premium off that. But most people will pay the base $174.80 this year. But some people will pay a lot more. And you don't know that until you actually go and sign up.
Right. Which is why I track it and like to know, because it's going to go into your retirement plan as well. Because you got to fund it. You got to be able to pay for it one way or another. So it's good to know that. Marty, am I leaving anything out? Did I just pass over a burning question? Well, I think you've given us all a lot to think about.
One thing I touch back on is the Part D. When I say, and I really keep reiterating that everybody's unique, because Part D on the prescriptions, we have to look at different carriers, and we have to look at your drug list. What medications are you taking? We've got some people that may take 20, may have some take 2. And we have to look across all the different carriers, who's going to cover in what tier. So you may have this carrier over here, you're going to pay $10 a month for your medication. Well, this carrier over here may be $20 a month for the medication, but this one is cheaper. So we have to calculate over a year what's going to be more cost effective. So there's a lot that goes on. And that's why, just going either online or calling somebody on the phone, there's a lot more to it. And it's always best to sit down with somebody and go through everything that you have. So I do insurance for a living. 99% of the people don't. So you need to stick to someone or talk with somebody. That's like on the financial side, speak to somebody that does that for a living, that's trained in it, to understand what you really need to get, because it's just not that black and white.
Okay. Marty, I appreciate it. I appreciate your time. I appreciate the insights, and I think this gives people a good overview at the right altitude. If you're approaching Medicare, you know how to tee up the conversation. Maybe if you're already on a plan or looking at switching, now's the time. We'll throw the dates out one more time, October 15th through
December the 7th.
Okay, October 15th through December 7th. Is there another time of the year? There's one time in March, I believe, right? Is that?
Well, you can,
that?
if you decide, if you had a Med Advantage, you have that window. You can say,
Okay.
wait, I want to go back to original Medicare. This is not working. You have that window to do that as well.
That's then next year, next March.
Right.
So right now, October 15th, December 7th.
Yeah.
Medicare prime time. Marty, thank you again. This is Matthew.Knight, financial advisor, Cetera Investors, with Marty Haynes of HFC Insurance. Marty, we'll get your contact slide up. We'll have contact info. We welcome questions and comments. Yes. Either way, we will get them answered if you have any. And we will see you next time. Thank you.
All right. Thank you, Matthew. Appreciate it.
Marty.